Hello, I'm Adam Pacitti from Cultaholic Wrestling, and you are watching Tom Talks Rubbish. It's the place for interviews, wrestling reviews, and so much more.
Sure, you subscribe to Tom Talks Rubbish. I highly recommend you subscribe here first.
What's going on, guys? It's your boy, Tom Talks Rubbish, and stand back with another interview. This time, I'm joined by a very good friend of mine, Alieshia Cross, a CBT therapist. So, welcome to the show, Alieshia.
Thank you so much. Thank you for having me. I'm really looking forward to this.
So, for people that may not know, what is CBT therapy?
Okay, so CBT stands for Cognitive Behavioural Therapy. So cognitive basically means the things that go on in our mind. So our thoughts and our beliefs and the images that we can have in our mind, because sometimes we don't always think in a verbal way. We can think with images too. And the behavioural aspect means the things that we do, the actions that we do, and also equally importantly, the things that we don't do, because avoidance of doing certain things can be a big perpetuating factor in lots of anxiety conditions and also mood disorders. And cognitive behavioural therapy looks at the way your cognitions and your behaviour interplay and how they impact on the way that you feel, and also how the way that you feel impacts on the way that you think and your behaviour. And because we can't just change the way we feel, cognitive behavioural therapy looks at changes that you can make to your thinking and your behaviour to have a positive impact on the way that you feel.
Okay, so for example, is it something that's normally prescribed by a doctor, or is it something that you might reach out to, like I don't know how it works, but like local therapist and say, I think I need CBT training?
Okay, so here in the UK, you can be referred by a doctor, often your GP. You can self-refer to NHS services, or you can find a therapist yourself, a private therapist. CBT is available in other settings as well. So CBT can be implemented in an inpatient setting. It can also be implemented in secondary mental health services, so where you might be under the care of a psychiatrist, for example. But yeah, most people in this country would refer themselves or be referred by a GP.
You talked about self-referral there. What are some of the signs that people might look out for and go, okay, I might need some help? Whether that be CBT therapy, whether that be a different kind of therapy?
I think it's usually when struggles with anxiety or your mood, often low mood, is really impacting on your quality of life. So it stops being something that just happens every now and then, and it's really impacting you often on a day-to-day basis. And when people feel like the self-help measures that they might be using and talking to friends and family isn't enough, that's often when people will seek out therapy. And sometimes people leave it even longer than that. They leave it till they're really, really feeling quite desperate, and then will reach out for therapy.
So, as I should have mentioned this at the start off, but as a trained CBT therapist, what is some of the training that you have to go to be qualified, certified as a CBT therapist?
So in this country, there are a couple of routes you can take. So if you have what's called a core profession, such as being a nurse or a social worker, you can then go on to do a postgraduate diploma in cognitive behavioural therapy. I myself, I went down the psychology route, so I did my undergraduate degree in psychology, I then worked in various different roles in mental health, and then I went on to do my postgraduate diploma in cognitive behavioural therapy. But it's really important to say that, you know, the way the law stands in the UK is anybody can call themselves a CBT therapist. And, you know, make sure that when you're looking for a CBT therapist that they have done a postgraduate diploma in cognitive behavioural therapy.
Okay. So you talked about there how anyone can call themselves a CBT therapist. What are some of the signs to look out for a good therapist? And then what are some of the signs that maybe, okay, this person doesn't know what they're talking about?
Okay, so for looking for a good therapist, so absolutely checking that they've done postgraduate diploma in cognitive behavioural therapy. Always ask about a therapist's qualifications. They shouldn't have any problems telling you what they are. Red flags would be if, like, someone's on a one-day course in CBT or an 8-week course, or you know, or they say they use CBT techniques. Now, using CBT techniques as part of a different therapy is all well and good, but that is not cognitive behavioural therapy.
Mm-hmm.
And also, regardless of a therapist's qualifications, and I'm not advocating going to somebody that isn't properly qualified, but you also have to click with your therapist. You've got to have rapport. You've got to have a really, you know, you've got to have a good therapeutic relationship. And although that can take time to build, you do want to click with somebody.
Mm-hmm. So as a therapist, what is some things that you might do to help maybe nurture that relationship that you're trying to build with patients?
So providing a space that is absolutely non-judgmental is absolutely crucial. So as human beings, we are all naturally judgmental. We make judgments all of the time, every minute of the day. But as a therapist, you overcome those judgments that you make, and you suspend your judgment. And it's very much about, you know, having a very warm relationship with somebody, genuinely caring. You know, your therapist absolutely should genuinely care about you, and that should come across in the sessions. Being honest, not being afraid to ask difficult questions, being aware of your own biases that you might bring into the therapeutic relationship, but always making sure that whatever you do is in the best interest of your client. Absolutely.
Mm-hmm. I should have asked you beforehand, is it referred to clients or patients?
Clients, because some people don't like the term patient because they feel it's too medicalized. So I always refer to my clients as clients.
Okay. So as a CBT therapist, where do they tend to work? Is it hospitals? Is it out of their own home? What is it, basically?
People, the CBT therapists can work in all different settings. So they can work in a setting called IAPS, which stands for Improving Access to Psychological Therapies, which is part of the NHS. And often IAPS practitioners will sometimes have a room in a GP surgery, or another building that has mental health services. People rent, you know, private therapy rooms. Some people have therapy rooms in their own property. CBT therapists can work in inpatient settings, in you know, inpatient wards, or like I said before, in secondary services, so community mental health teams.
Yeah.
In prisons as well. So the forensic side.
So if you are looking for a CBT therapist, we talked about what makes a good and a bad, but like, how would you contact like, and say I need CBT therapy? I know you said you'd go to a doctor.
Yeah, so I mean, most people that I have as my clients, they find me on the internet. So, you know, good old bit of Googling. If you want to go down the NHS route, you can just have a Google for NHS talking therapies, and you can refer yourself that way. Or you can go to your GP.
What about yourself as a therapist? Do you look at people and think maybe they'd be good for CBT therapy, or is it like they get referred to you, you'd never refer someone to yourself, sort of thing?
So with me, the vast majority of people, they just contact me themselves, often by email. Sometimes they'll phone me directly, and then I offer a service where I'll offer a free 15-minute chat, just so it's nice to have a chat, so you can kind of get a feel for each other, get an idea of whether you're going to be a good fit as, you know, therapist and client. It gives a person the opportunity to ask any questions they may have. I mean, they can always email me questions or, you know, message me, but it's just nice to get a good feel for each other. And I'm always very honest. I always tell somebody if from that 15-minute chat that I don't think that CBT for them at that time, or for what their issue isn't right, I will tell them and I will signpost them to other services, and that does happen.
Yeah. So what kind of, and correct me if I'm wrong on using the right term here, but what kind of, I want to say issues, but like issues would CBT therapy be used to treat them? Is it mainly anxiety?
CBT is really good for people who struggle with anxiety, so a whole range of anxiety disorders, and post-traumatic stress disorder as well, and complex post-traumatic stress disorder, you know, generalized anxiety disorder, OCD, so obsessive compulsive disorder, phobias as well. So, for example, people who have a phobia of spiders or needles, and then also you know, mood disorders as well. So people who struggle with low mood, people who struggle with major depression. CBT is also used for people with eating disorders as well. And a particular interest of mine is something called CBTI, which is cognitive behavioral therapy for insomnia, which is a standalone therapy in its own right. It's slightly different to you know, usual CBT.
A couple of questions there. What got you so interested in the insomnia side of CBT? And then what are some of the differences for CBT insomnia?
So what got me really interested in CBT for insomnia is because I have struggled with insomnia for so much of my life. And I implemented a lot of CBTI strategies myself. And it had such a dramatic effect on me, really dramatic effect. And then I was lucky enough to do my training in CBTI with the University of Oxford. And it's such a powerful therapy, and often you can get people that have tried so many different things for so many different years and are convinced that nothing else is going to work. And, you know, often, you know, CBTI does. To explain the way that CBTI is different from standard cognitive behavioral therapy, I'm probably going to get a bit academic here, but
okay.
CBTI is lots of different specific therapeutic techniques that are put together to form a particular treatment, whereas CBT in a more general sense is much more kind of adaptive and much more responsive to the particular idiosyncratic nature of each client, so the things that are really individual to each client. I hope that makes sense.
So to break it down for people that may not understand, essentially CBT generalized is more a general for each patient, and then CBT insomnia is more a regimented plan. If I got that wrong, please correct me on that.
Yes, it's kind of a bit more regimented, and it tends to take a shorter treatment duration, and you don't necessarily have to go, so in depth with people. But then that's not always the case. Mm-hmm. So often I will incorporate bits of CBTI within the clients that I see for other issues, because nearly always with certainly low mood and often with anxiety, people's sleep would be disrupted.
Yeah. So obviously, and it's changed over the last few years, but sometimes therapy can have, I don't want to say a stigma, but you know what I mean when I say it, don't you?
Yeah, sure.
If someone says they're in therapy, I wouldn't personally, and I know you wouldn't, but there's people out there that might look at you a bit funny if you'll say you're in therapy. So for people that maybe don't want to go into therapy, what are some techniques or some things they can change in their own lives to maybe improve how they feel, sort of thing?
Oh, so you mean, so if people don't want to see a therapist, how could they help themselves?
Basically, yeah.
So there are some really great CBT-based books available. So there's the Overcoming series, so like overcoming anxiety, overcoming worry, overcoming OCD, and they're written by some really prominent CBT therapists, and they're really good. They're really good books to use.
Okay, but what about people that don't want to go down the CBT route at all? What are some things that they can change in their lives to maybe improve their mood and stuff?
Okay, so I mean, for exercise, I mean, the research behind exercise and the benefits it has, the positive benefits it has on your mood and anxiety levels, there's so much research about it, and it's one of the best things you can do for your mood and your well-being. So I mean, obviously not only are you getting mental health benefits, but obviously you're getting physical benefits too, and it doesn't have to involve going to the gym. You want to aim for about half an hour a day, and that can be broken up into as little as 10-minute sessions. So something like going for a brisk walk, 10 minutes 3 times a day. Not keeping things bottled up, so making sure you talk to people about how you're feeling. A friend that you really trust or a family member is really important. Not to keep things bottled up, and you really are never alone.
Mm-hmm.
You really are. You really aren't. Sorry, you really aren't never alone.
There's
always somebody else that's. There's always somebody else that's struggling, even though depression and anxiety can get you in its grips and make you feel so isolated and so alone, and like you're the only person that is struggling this way. It's absolutely not the case.
Okay, so then how important do you think people's support systems are to their mental health?
Massively important, and we know this from research as well, that people that have good support systems in place are less likely to have struggles with their mental health, and also that they are more likely to make a better recovery and a more sustained recovery. So support systems are really important.
Okay, so I mean this again in a nice possible way, and I am trying to be very diplomatic because obviously these are sensitive issues we're talking about. But
it's okay. I'll pull you up if you say something you shouldn't.
She does normally, guys. So yeah. So as I say, if someone doesn't have as good support system, do you think they're more likely to suffer from anxiety and mental problems, for lack of a better word?
Yeah, I mean, that's what the research shows us. And I think that's another really important thing to say about CBT is that it's an evidence-based therapy. So all of the strategies that are implemented have a wealth of evidence behind them, and it would not be ethical to implement a type of treatment strategy that didn't have an evidence base behind it.
So if, like, as we wrap this up, so I do want to be very respectful of your time. If the good people want a CBT therapist or someone to talk to, would you agree that the Samaritans and helplines like that are good, or would you prefer like face-to-face contact?
I think the Samaritans are absolutely excellent. They're a brilliant service. I would recommend, anybody to contact the Samaritans. I think they're absolutely fantastic. And there are lots of other helplines available as well. So people can just search mental health helplines. There are ones specifically for men, for example. I think helplines are a really good thing.
As a therapist as well, because I'm very curious to know what you think about this. Does phone therapy work, or do you find it easier, like face-to-face with a client?
To be honest, remote working works really well. Again, there's been research done on it, and it shows it's just as effective. So yeah, it does. It works really nicely, and there's pros and cons to both. But for example, working remotely, you can choose any therapist in the country. You don't have to worry about travel constraints. I guess the downsides are like if where you live, you're not able to have your privacy and you're not able to feel confident that you can speak without being overheard, then that would be a downside. But on the whole, it works really well.
How do you feel that like lockdown and that has changed the way therapists work?
So I think that it's really enabled the world of remote therapy to flourish, and it's become much more acceptable to see a therapist remotely. I think people feel that they're not losing out as much by seeing a therapist remotely. I think that lockdown in general has had a massive negative impact on people's mental health.
Yeah.
Massive.
But do you feel like there's any positives to lockdown when it comes to mental health? Because I feel like the negatives are always spoke about.
Yeah, I think that's a really good question. Really good. I think that there can be, depending on your situation. So where people were forced into a position where they couldn't work, it can allow people to spend more time with their family. And for some people, this is a really good thing. So it can allow, relationships to deepen, and just, spending more quality time with family. I think slowing down the pace of life has made many of us aware how fast life is paced, outside of lockdown and a pandemic, and appreciating the sense of community and the sense of connectedness, and appreciating, the basics of life, human connection, human touch, being able to socialize, having a strong sense of community. I think that's something really positive that's come out of the pandemic is, having that sense of community that perhaps, modern life had it made us lose it.
Mm-hmm. So as we wrap this up, where can the good people find you?
You can Google me. You can type my name in. I think my name will be on your video, won't it?
Yeah.
And I can send you some links. You could put them in the description box of your video.
Yeah, if you send me links, I will put them in the description.
Yeah. So you can contact me through my website. That's got all my details on it. It's got like a contact form. You can email me, you can phone me, you can text me, you can WhatsApp me. You can reach me in lots of ways.
Very well worth doing, guys, if I'm honest. So as I wrap this up, if you guys like this video, make sure you like, share, and subscribe. And I will see you in the next interview. Bye. Bye.